Sports concussions are more common than you might think, and they should be taken very seriously. Dr. Hulvey from the South Carolina Sports Medicine is here to talk about the signs and symptoms of concussion. And first, let's start off with what exactly is a concussion?
Well, first off, Tom, thanks for having me. A concussion is a temporary disturbance of brain function brought on by either a direct or indirect blow to the head. It's what we call it's a functional disturbance. It's not a structural injury, so it's not something that can be diagnosed either on an MRI or a CAT scan. Some of the more common symptoms of concussion are going to be headache. That's going to be the most common symptom. Second on that list is dizziness.
Okay.
Oftentimes athletes or patients will complain of fogginess, sort of feeling like they're one step behind themselves. Fatigue, irritability are also pretty common symptoms.
Not running on all cylinders, so to speak.
Exactly.
In some ways. You got the headache and just say, whoa, what is going on?
And that comes back to that feeling of fogginess. You know, oftentimes athletes will complain of seeing things, you know, sort of in regular definition rather than in high definition. Other common symptoms can be difficulty with concentration and memory difficulty. And also sensitivity to light and noise can be something that's very specific to a sports concussion. And you'll notice that I didn't mention loss of consciousness as one of the main symptoms. This used to be one of the hallmark symptoms of concussion, but it's actually only present in about 10% of the cases.
Okay. What are the different levels of a concussion? I hear people say, well, he had a mild concussion. He had a severe concussion.
I'm glad you...
What are the differences? I mean, because that can be confusing, especially maybe to parents who have children in sports. And it's not just children who can have concussions, as we see so much on the football field.
Absolutely. Well, I'm glad you brought that up, Tom. You know, years ago, we had different grades of concussion. We had complex, simple, we had grade 1, 2, or 3. Most of, or actually I should say all of those grading systems are really not used now. Every concussion is different, sort of like a snowflake. No two concussions are alike. We manage concussions these days as physicians and as athletic trainers. We manage concussions based on the individual patient and their history and their presenting symptoms. So the grading systems that were used are somewhat obsolete. So we base them based on each individual concussion.
A child comes in from playing football, took a big hit to the head. The parent says, you know, he's talking about being a little dizzy, he's a little bit nauseous, he's got a headache. What kind of things are we looking at there?
Well, it's, the symptoms that you just described to me sounds like this hypothetical case. This child had a concussion. So this brings us to the management of sports concussion. Anytime you have a situation where an athlete is suspected of having a concussion, the first step is to remove that athlete from play. There is no return to play the same day that the athlete is had a concussion or even suspected of having had a concussion.
And that's common sense, even though some people might say, well, you know, he just had a good hit, he's back in the ballgame. But he really needs to be, he or she really needs to be removed from that play right there.
True, again, and that's an excellent point that you bring up, and you say, and you know, and talking about it here in this controlled environment, it does sound like common sense. But when you're the physician or the athletic trainer or even a coach, and you're in the heat of the moment, your best player just got hit in the head, and they're complaining of those symptoms, and you can imagine the temptation to want to clear that athlete to returton to play, and that's absolutely what you should not do in a situation like that.
Safety is paramount.
Absolutely.
Safety is paramount.
Absolutely.
How long do concussions normally last?
Well, again, it varies significantly from athlete to athlete, but typically symptoms will last anywhere from 7 to 10 days. In about a fifth or 20% of the cases, you can have athletes who have symptoms that last longer than 3 weeks, and in some cases, you can have symptoms that last months.
Let's kind of run a little quick gamut of sports that deal with concussions, because, I mean, from boxers to football players to gymnastics.
That's right. Well, the short answer to that question is concussion can occur in any sport, even things like gymnastics and cheerleading. We see those patients in the office from time to time. But the most common sports are going to be the collision sports, things like football and hockey. And if we're talking about about risk factors, children, adolescents, particularly that pre-adolescent period before the brain has fully developed.
Yeah.
Those athletes can be particularly susceptible to concussion. Also females. Because the theory being their neck musculature is not as developed,
Sure.
and so they perhaps have a little bit harder time absorbing that that blow that can lead to a concussion.
Yeah.
So those are going to be your main risk groups, and also athletes who have had a previous history of concussion are thought to be at increased
Where can
risk.
folks get a hold of you, your office?
So we're at South Carolina Sports Medicine.
Okay.
We are a comprehensive sports medicine and orthopedic practice up in North Charleston, and the address there is 9100 Medcom Street,
Yes, sir.
and the phone number is 572-BONE, B-O-N-E.
Easy to remember. Doctor, thank you so very much.
Thank you.
More coming up with Low Country Live right after this, so stay with us.